So the speakers that are on, we can just have a quick chat. As you would have noticed, we have 5 minutes running schedule. Please, with all due respect and humility, just let's try and keep to the point and keep to the times, because it's not, we want to make sure all our audience have the opportunity to speak or maybe ask questions. I'm sure by the time those questions come through, you would have, come across some of them that you haven't even touched on that you can address in the course of time. Obviously, we will let you get on with your work until all of you have spoken, then we will go straight to Q&A. Dr. Abdul has provided this, a video with permission of the mom, who we will show. We will also have one person, just one person after Dr. Abdul, just to give an experience of having taken the vaccine. And that is the only thing that I should make you aware. If you don't mind, with all respect again, I will be referring to you by your first name and your title, rather than having to go through which surname is this one and that. But we want to thank you for your time and the opportunity to share your knowledge and experience with the community. We will have a lot more to do with you going forward, and welcome to our forum. Thank you. And my name is Emmanuel Kwesi, the chairman of Ghana Union, along with other people who are partnered with us, Ghana Nurses and Western Region Nurses Association. There are a lot of resource people, some of whom are versed on the field of medical practice, who will be helping along the way. They will not be speaking, but obviously they might chip in behind the scenes on the chat or anything that will flag up. We will take the questions through the chat, and some of them to have sent some to me by WhatsApp. So we'll put the question, and any of the panel who is versed in the area should be able to say, look, I'm taking this one. Just raise your, just unmute yourself and go for it if you think it's an area. But I think that's the brief that I have. I don't know if Betty or Catherine has anything to add to it, please. I think we've muted Catherine. He said he doesn't have that. Paul.
Sorry.
No, yeah. Thank you.
You're talking through the air. We can't hear you. Have you muted yourself again, Catherine? You need to unmute, Catherine.
Okay, yes, no, it's fine.
Yeah,
it wasn't allowing me to before. No, I think you covered all the main points there. I just have a quick query about the poll, because the poll is still coming up on entry, and I thought we were going to run it after the introductions.
Oh, is this still coming up, Paul?
Yeah.
Paul, is the poll still coming up on entry?
It shouldn't be.
It shouldn't, because
sorry. When we were doing the test, we forgot to end it. Sorry.
Okay.
Sorry. Okay, it's ended now. It should be fine.
It looks like Vanessa has a question.
We're just doing a test. Yeah. Okay.
Yeah, just a quick question. So in terms of the slides and the presentation, because we sent them to you, will you be controlling it? And so we'll be saying next slide, or we'll be sharing our screen?
Paul, how do you want to handle that?
I can send it if you want to share it. If it's easier for you, I can send you the I can let you share it from your end. That's fine.
Okay, whichever you think is easier, because I know sometimes it's clunky when. So
okay. Just a second. Hold on. Let me do this and let me know if you can.
It's probably better for one person to share it, because sometimes you.
It gets.
Yeah.
So long as you don't mind if we keep saying next slide, next slide.
Or you just have to share it and then follow them as they do it. There's only 3 of them that has provided a slide anyway, so
okay.
We're not looking up all the.
Okay, I'll handle that. You handle it. So just say next slide.
Perfect. Okay, thank you.
That's useful. Thank you.
Oh, quick question. Somebody's got their hands up already. Martha.
Martha. Unmute Martha. She's the GNA to say. We've got 3 minutes to.
Where is she?
Yeah, and
okay.
Yeah,
Martha,
I couldn't say anything because.
Where is she?
Martha Nugent.
Okay.
It's hands up, and I think Irene is also trying to get in.
Yeah, I'm in now. I've just got in.
Okay.
So I'll put my hand down now.
Okay.
Thank you.
Okay,
Yeah,
so
Mr. Quincy.
Martha, is she
Paul,
also
can you
speaking?
please
No.
can you please let me in by my laptop so that I'm coming out of my iPad, please?
Right.
Who's that?
Martha, so will your laptop have your name, or what name is that going to be?
That will be
Nugent. Okay.
Yeah, it's connecting.
I got her in.
It's connecting.
Yeah,
Right.
thank you.
Thank you for letting me in. I'll come
So
out
take
of
yourself off this so that we don't.
Yes, I am.
We've got 2 minutes to go live.
Okay, I'm going to start the Facebook and YouTube now, yeah? So my camera is going off, my audio is going off.
It's Catherine, but don't worry.
I think we all might want to mute ourselves, yeah.
Yeah, I think all those with muting rights should mute themselves or when they are ready. Dr. Dansu will be joining us after 7 because she's finishing 7 and she'll be aiming to join us 15 minutes or late. She's not speaking till later part of the session anyway, so hopefully she'll be in time for that. And I think Belinda too has another engagement about 8:30, so she might leave once she's finished her bit. So just for those of us who are part of the team to be aware, if you see her disappeared, it's because she's got to attend something else. But the rest of us, especially the panelists, I may ask you please to try and sit through because we never know what could come as a last minute question, if you don't mind. Betty is waving to us. Betty, do you want to unmute Betty, please? Linda.
Emmanuel, I'm going to share a screen whilst people come in so they see.
I've done that.
Right.
Yeah, Dr. Danso is in as well now.
Oh, great. Okay. Right.
Okay, I guess we can start. It's 7, isn't it? Is it 7?
7. So
yeah.
I'm just going to admit everyone.
Yeah, you can start admitting, yeah. So I'll leave the screen on there for about 2 minutes.
Catherine. Yeah.
I can't unmute myself, but Dr. Bola is stuck in a traffic jam.
Paul. If Paul can hear me. Paul. Let me add Paul to the call. Paul. Paul. Paul, are you there? Yeah. Paul. I'm trying to talk to you. That's what. Sorry. Okay. Okay, good evening, ladies and gentlemen, and welcome to the Ghanaian Community Awareness Forum. This forum is intended to help our community understand, gain knowledge, and inform ourselves as to the issues around COVID and the vaccines. Today, we are lucky and blessed to have experts who are versed on the field of their work and are able to share knowledge with us to help all of us understand the issues. My name is Emmanuel Kwesi. I'm the chairman of Ghana Union, along with my colleague, Winifred Ohinikisi, will be hosting you. We also have other resource people who are part of the composition of this program from Ghana Nurses Association and Western Region Nurses Association. I would like to apologize that one of our panel is stuck in traffic, so hasn't been able to join live as we speak. So we will start with those that we have who will equally address their areas. And once we are able to get connected, we will move on. We have with us panelists today from no other, in terms of no other priority, but we want to acknowledge the presence on this forum, Dr. Vanessa Appiah. Dr. Vanessa Appiah is a consultant physician in genitourinary and HIV medicine and clinical lead in sexual health at Bath Health NHS Trust. Dr. Vanessa will be going through a series of issues around the vaccine, the types, and how it works in the human body, including manufacturing, clinical trials, speed of approval, differences between vaccines and effects, side effects, and will take us through the first and the second doses and whether or not we are able to mix it as people. We also have Dr. Abdul Sabaru, he's a general practitioner in Southport, Merseyside. His passion is helping people in terms of well-being, being healthy, and living well. Dr. Zabaru will be addressing the 5 top most common questions about the vaccines. We also have with us Dr. Adwoa Danso, a London-based GP and a board member of the Ghanaian Doctors and Dentists Association, UK. Dr. Danso will be looking at risk factors relating to the vaccination and will address areas around workplace assessment and what are the issues that exist within our areas that we work that we need to take care of or take note of. We have Belinda Danso Langley, who is a community pediatric service lead for a London Borough, managing immunizations task force, consulting pediatricians in child development services, and will be taking us through anti-vaccination messages. We will then move on to the second part where there will be a Q&A, and we want this to be about the audience, so we will give our audience enough time to ask all your questions. In the meantime, if you have any pre-advanced questions that you want to ask, you can either use the chat forum on the Zoom and put your message there, or you can send it by WhatsApp on 077 343 12820. 077 343 12820. Some few rules that we may have to take note of, please, as you join us today. We will, at this point, after going through the rules, have to observe a minute silence in recognition of the many lives this virus has taken around the world, and most importantly, equally as within our own community that we focus on today. We will then follow on with presentation by all the panelists, and we'll go through all the questions that we have received in advance. As you would notice, audience will be muted throughout the session, and we will not have the right to unmute yourself unless otherwise we do it from our end. So the easiest way for you is to raise your hand using the Zoom button or icon to raise your hand, and we will call you. Where possible, we may ask audience who want to ask a question to show their face, and please say your name for at least so that we know who we are talking to, where possible. No audience screen sharing will take place. We wouldn't accept any audience sharing the screen and showing anything else. Please bear with us because we want to make sure this is organized well and handled well in order that as many of you will get the information and the purpose will be met. We will be asking you kindly to go straight to the point when you're asking a question, and please be precise with the question so that the panelists will be able to address it. So these are a few rules that we may ask you to help us follow. Somewhere along the line within the presentations, we will ask you to do a bit of polling, only for us to gauge where we are as a community, as people, and also to know whether at the end of it all, this session has helped you to understand things a bit more and hopefully help you to make better decisions going forward. There will be no names, there will be no identity to this polling. It will be a matter of either yes or no, and there will be no personal information taken at this point from our side. So before I go on, may I ask that we all wait for a minute's silence in memory of the very loving ones, family, friends, family members, colleagues at work, community people that we've come to know over the many years that we have so sadly missed. May their souls rest in peace, and may their passing be a blessing, and their memory live on. Thank you. At this point, I will introduce again, as I have done already, Dr. Vanessa Appiah to lead us with this conversation. Thank you, Doctor. Please unmute yourself.
Thank you so much, and thank you again for the invitation to speak today. I just have a couple of slides to go through, just to talk through the vaccine. But as they come up, I just wanted to say to everyone that the reason that I'm here, and people often ask, why do I come and talk about it? Am I being paid? You know, what's my role in it? And for me, the only thing is not being paid, not being not associated with the government and other bits like that. For me, it's just so important that for us as communities, we just have access to the right information so that we can all make informed decisions. So I'll just go through the slides. Thank you. So next slide, please. And again, I think for here, I just put this emphasizing the power of choice, that we all are here to make the choices together. So first of all, next slide, please. When we're thinking about vaccines, I think it's really good to step back and think about what actually are vaccines, because we're hearing about it all the time. So vaccines all work by making our body think that we have part of the COVID-19 virus, that it's attacked our body. And then at that point, our body then creates an immune response, even though we haven't been actually unwell with the virus. And then as the body creates that immune response, that means that we then have protection against the virus. Now, the different vaccines differ by how the actual virus that is taken into the body. But the key thing is that with the vaccine, whatever it takes in, it's not live, it's not an active infection. And that's really important. So vaccines tell our body that it's been exposed to the virus. Our bodies then create an immune response to protect ourselves. Next slide, please. So one of the things that really comes up all the time when we talk about vaccines is that people ask, how have vaccines been made so quickly? And with that, does that mean that anything has been compromised? And so when I look at this image here, I just want to show you that when you're making a vaccine, it goes through many different phases through research. So you have preclinical, phase 1, phase 2, phase 3. And then you've got regulatory bodies that have to look at the data and look at it and approve it and then manufacture it. And that can take any number of years. But what has happened in COVID-19 is this has happened extremely quickly. But what we need to highlight, if you look at the second part of the image, is that still every step has happened as we need it to happen. Next slide, please. And the issue is why it was happened so fast is that what is really important to know is that this just didn't come from anywhere. So when they were making the vaccines, they had knowledge from previous history. So with SARS and MERS, which are other coronaviruses, when those were coming up, there was a lot of work that was done to think about vaccines for them. So we've got a lot of information on different platforms for over 20 years. The next thing is that money talks and political will talks. Now, at this time with vaccines, there has never been a time where people have put in so much money, both in public and private investment all at one time. And for the government to say, right, we are pushing this and we're pushing this agenda. And another key thing is that when you're making a vaccine normally, or you're making a drug, you normally take a risk on it as a company to make it. But the government said to all the companies that please make it, you're not taking on any risk, just keep on doing it and we will buy it for you. On top of that, there was the approval process. Normally, if I'm doing a research study, it can take a long time for the approval process to go through, because it takes a long time for the people that are approving it to come together and do it. But in COVID-19, everyone came together. They came together quickly because it was their focus to make sure we treated and were able to get a vaccine as soon as possible. And the other thing is that when you're doing a research trial normally, if you're trying to recruit people, it can take such a long time. But people came forward just by themselves. Thousands of people came forward. Social media was so powerful. And there was a really strong public desire to help and make the vaccine. But please remember, there was no compromise on safety, on scientific or any ethical integrity. Next slide, please. Just onto the next slide, please. And the other issue with the trials is actually who took part. A lot of people get concerned about this. Just to reassure, there was really good representation in the trials. And I'll go through quickly the different vaccines that are there. But the two main ones that we all know about in here, Pfizer and AstraZeneca. So the Pfizer study already has happened in 6 countries, over 44,000 participants. And when we look at the breakdown, at least 9.6% were Black and African, 26% were Hispanic and Latino. And if you look at AstraZeneca as well, there was at least 10% that were Black. And this is really good representation and even better than a number of studies. And there's been no evidence to suggest that the vaccine platforms behave differently in different ethnic groups. And the data that we have really supports that. Next slide, please. So when we think of COVID-19 vaccines, another thing is that people get concerned about is what are they actually made of? Now, if you've got the vaccine, as I said, and you've got the virus that needs to, the inactivated or dead virus that needs to be go into the body to tell the body to make the antibodies, then it needs to be carried in an injection. So it's wrapped around in different fluids, lipids, salts, and sugars. But it's really important. There are no fetal cells. There are no microchips. There are no animal products. And in fact, there's some concern that there are any content of alcohol. And just to say that there is no significant amount of alcohol in them, and the ethanol content, which is aligned with alcohol, the content in one of the vaccines is less than what you find in natural foods and bread. So it is safe to use. Next slide, please. So we have different types of vaccine, as I said, and the big difference is that it's different companies that are making it. But the other difference is just how we are able to get that bit of code into the body to tell the body to make antibodies. So if you look at the Pfizer one, it uses an mRNA to take the virus in. If you look at the Oxford, the AstraZeneca, it uses a different virus to take it in. But what again is really important, that it's just like, I think of it like a vehicle that takes it in, goes into the body and tells the body to make antibodies. At the moment, we have the main vaccines that are currently licensed. You need to take 2 doses, and you take 2 doses of the same vaccine. At the moment, in the national guidelines, we are taking them 12 weeks apart. The reason for this is that it's really a public health decision. We want as many people as possible to have the first dose, and we want to reduce the risk of death and hospitalizations. So because of that, the spacing has been 12 weeks to make sure that we have enough. Many people ask, okay, I was given Pfizer. Can I be given the second dose? Will it be different? At the moment, the current guidance is no. If you have Pfizer for the first dose, your second dose will be Pfizer. If you have AstraZeneca, your second dose will be AstraZeneca. But there are trials ongoing to see, can you mix them? Now, the only reason that we would mix them is it gives us, in the future, it may give us flexibility as we're rolling out the vaccine, and it also helps with any distribution to supplies as well. But really, at the moment, you take the same vaccine each time. Next slide, please. And so just lastly, a big thing that always comes up is what are the side effects? And I can say I have had the Pfizer, the first dose myself, and I can attest to these side effects. So what's really important is that there have been no significant reportings of serious side effects. The most common side effects across all of the vaccines are local pain as you have the injection, some tiredness, headache, and muscle pain. And that's typical that you feel a bit tired and run down. That normally happens about a day or two after, which is what I experience. And then it quickly settles down. Now, for each of the different vaccine types, we are learning that sometimes the second dose, you may feel tireder than the first. So that's what we're seeing in Pfizer. But in AstraZeneca, what we see is that the second dose, you feel it's better than the first dose. But generally, it is really mild symptoms that you experience. And there are limited and very, very, very few experiences of serious side effects. So I'm just going to stop there and then go to the other speaker, and then I'll be really happy to answer any questions afterwards. Thank you.
Thank you so much, Dr. Vanessa, for this information. We have Dr. Bola, who is calling in because of the circumstances in now. She can only do by audio. Dr. Bola Oluwabi is a GP and a Deputy Medical Director at Derbyshire Community Health Services, National Specialty Advisor for Older People and Integrated Person-Centered Care. Dr. Bola will take us through health inequalities, setting the context for COVID in the Black community, looking at higher mortality rates, more severe illnesses. She will be seeking to flag the gap in vaccination uptake in the wider community and speak to issues of low intake, including amongst healthcare professionals. Can we have Dr. Bola, please, addressing the audience?
Hello, I hope you can hear me, and I'm really sorry I've pulled over. So all you'll see is just the light in my car. I suspect you can't see me properly, so I have pulled over to join. Thank you so much for having me on the call today. And it's a great privilege to be here. This is my week 6 as National Director for Health Inequalities at NHS England and Improvement. And it's incredibly important to me that we do get this message across. So a lot of colleagues on the call will remember that last year, we started to get a lot of data coming through showing that the severity of the disease and also the rates at which people died was significantly higher amongst Black, Asian, and other ethnic minority groups, whether you were looking at the community as a whole or indeed healthcare professionals. I've only got to cast your minds back to the harrowing pictures that unfolded on our screens as we began to see doctors, nurses, other healthcare professionals dying in the very first wave of the pandemic. And it was alarming to begin to see that actually the picture that unfolded before us was that most of those people were from ethnic minority backgrounds. And at that first wave, it ended up being that 62% of the healthcare professionals that died were from a Black, Asian, and other ethnic minority backgrounds. And then we started to get the Public Health England and the Office of National Statistics data coming through, also showing us that an African man had 2.7 times the risk of dying if he developed COVID infection compared to, say, a white person. And so this is the background that we've come from. And for me, looking at that really harrowing background and the fact that we've not even come through the pandemic yet, we are still in the middle of a pandemic. Yes, we can see a path through in form of the vaccine, in form of the various programs that have been put in place, whether that's the social distancing or indeed the lockdowns. The truth of the matter is we are not out of the woods yet. And what worries me more is that as we are starting to see some of the publications coming through about the COVID vaccination uptake, the same community, our community that has been most impacted in terms of the severity of disease and in terms of the level of deaths that have occurred, the same community is emerging as the one with the least uptake of the vaccine. And I stand bewildered as a healthcare professional thinking, what can I do? Not just in my role nationally, but in my role as a GP. You know, the reason why I've struggled to join you this evening is because I finished late at the surgery and was hustling home and ended up in this traffic. What can I do, you know, as a GP? What can I do as a part of this community to really shine the light and say, if we carry on this path where we have much lower uptake of the vaccine in our community, I shudder to think by the time we get to summer this year and we look at the death numbers, the proportion of those numbers that will then be made up of our community that has already borne the brunt of the mortality statistics already, of the severity of disease already. And, you know, all I can say is to absolutely echo what Dr. Apea has been saying there, which is, look, this vaccine has been made, these vaccines have been made to the highest exacting levels of safety and efficacy. No shortcuts have been taken. The reasons why it has happened so quickly is exactly the reasons why she has outlined. And I'll just go on to say that looking again at some of the early data around the vaccine uptake amongst healthcare professionals, again, we're starting to see the same picture that is happening in the community emerge even amongst us healthcare professionals, where the uptake is again at the lowest amongst particularly Black African colleagues. And I'm just here to just really put in a professional plea to say, please don't let this happen. This doesn't need to happen to our community. We don't need to lose any more people. You know, we've already done a minute silence at the beginning of this program, and rightly so, absolutely the right thing to do. But, you know, if taking the vaccine is the way we're going to make sure that by the time we get to summer of this year, the Black African community is not disproportionately represented in the death rates. If what we need to do to make sure that that doesn't happen is for us to rise up and do our bit and take this vaccine, then please let's do it. You know, we're doing more difficult things. We are working incredibly hard. I know that all of you on this call are absolutely committed to the health and the well-being of your families, of your communities, of your patients. I know that because you are on this call. Look at the time, it's 7:30, and this is going to carry on for a while yet. You've bothered to be here. So I know that you care. I know that you care because you're here. I know that you care because you've chosen this vocation. And I just think this is a moment in history that we need to be able to look back and say to the generations to come, I did my bit. I stepped forward when the opportunity presented itself. I couldn't save the world and I couldn't save everybody, but that was in my power, what was in my gift to do, I did. I worked as a healthcare professional and I stepped forward and I took the vaccine in order to absolutely stop this awful disease in its tracks. Look, I haven't got data slides or anything like that to share with you. This is just an impassioned plea to say the data that is coming through in terms of the vaccine uptake, it really is sending shivers down my spine about what we are going to see in the months to come, where the death rates overall come down, but then when you interrogate it further and you look into it, you suddenly see that our community has been even more represented in the death rates. It doesn't need to happen. Please, let's take that leadership position, because whether you like it or not, we are leaders in our communities. People trust us, they respect us, they listen to us, they take what we say seriously. And I think as the data comes through, if it becomes apparent that actually we ourselves are not stepping forward, then we can't blame our community for not following us to do the right thing. I've had the vaccine, and I'm still here and I'm fine. Yes, as Vanessa said, I had a sore arm for a day or two, and that was the end of it. But in my own heart, professionally and morally, I'm coming away with that sense of, look, there were thousands of people who stepped forward to be part of the trial when they didn't even know what the outcome would be. Let's think about them. We only have the vaccine now because we had tens of thousands of people who stepped forward to be guinea pigs when they didn't even know whether, what the outcome was going to be in the trial phase, and yet they did it. That's why we have the vaccine now. And I just think, the thing that all of us can do to just really appreciate them is for us to step forward now and take this vaccine, protecting ourselves, our families, our communities, those patients that we really care about. I think this is the one thing that we can all do and be proud of, on top of all the amazing work that we do day in, day out, in whatever role that we play in the NHS. I leave this plea with you. Please, let's do the right thing. Please, let's overcome all of the anxieties and the doubts, and we will continue to address the anxieties and the doubts. We're not dismissing them, but I'm just here to say, please don't let a summer of untold heartbreak in our communities, please don't let it happen just because we haven't stepped forward to do what we know is the right thing. Thanks for having me.
Thank you, Dr. Bola. This is a very passionate plea, and we are grateful. I'm sure those who are able to join us will pass this passion to as many people as possible to help our community to come out of just becoming statistics of bereavement within our community. We are going to run a poll, just a quick, so that the rest of the panelists will also help to gauge where we are as it is. Before the poll, may I also say that there are partners who have put together this program. It's going to be run every 2 weeks from today. So our next session will be on the 26th of February. We hope as many of you will join us, and we'll be looking at a variety of other issues. It's going to be running for the next couple of weeks. So we need you to get involved, engage, so that we can bring you all the good news around the issues that we are so well or dear to. We want to acknowledge World Remit as money transfer company who is also helping us to deliver the sessions from community perspective. Ghana Union, the umbrella body for most of the Ghanaian community groups within London and its environs. We also have Ghana Nurses Association, a professional body, a very vibrant one, based in London and around the UK, who has membership that are more spread around the hospitals that we all go and visit when these situations happen. Western Region Nurses Associations are also part of this, and want to acknowledge their work in the area of health, supporting the needy in many areas. Ghana High Commission, our overall body that is here to represent the government of Ghana, is also partnering with us to deliver to you this program. We will run a quick poll so that we have an understanding of where we are, and then we will move on to the next speaker, please. So we will progress and go through other areas that are of interest to this forum. We will now be calling on our next panelist, Dr. Abdul Zabaru. He's a GP in Southport, Merseyside, and he has passion in people becoming well and living well and doing well in their lifestyles. So Dr. Zabaru will take us through the next session of this engagement. Dr. Zabaru, please.
Thank you. I'm just waiting for the slides to come up. Great, thank you. Welcome everybody. It's great to see so many people here tonight to have a really important conversation around the COVID vaccine. I'm here because I've got a passion about healthcare and lifestyle, and I've written a few articles on vaccine hesitancy in the minority ethnic population, and being fortunate enough to be on TV to try and get the message across. So this evening, I've been tasked with providing some answers to some of the common questions that have been coming up with regards to the vaccine in terms of health conditions, and I'll also try and tackle some of the myths and misconceptions around the vaccine. Next slide, please. So, fertility and pregnancy. Are vaccines safe for people wanting to get pregnant or for people who are already pregnant? There's lots of questions about this from women of all reproductive age about the safety of vaccines on fertility. The British Fertility Society have stated that there is no evidence that the vaccine can affect fertility for women or for men. In terms of pregnancy, when you do clinical trials, as Vanessa has stated, certain groups of people are excluded, and that's certainly true for pregnant women. So it's not to say that the vaccine is not safe in pregnancy, it's to say that there isn't the available evidence currently to say that it is safe. So initially the advice from Public Health England was that don't have the vaccine if you plan to get pregnant within 3 months. The Joint Committee for Vaccinations and Immunisation have revised that ruling, and the current advice is that those who are pregnant should not routinely have the vaccine. The exception to that is that if you are pregnant and you are at high risk of catching COVID, or you suffer from a clinical condition that puts you at high risk, you should have a conversation with a medical professional about the pros and cons of having the vaccine. Next slide, please. So underlying health conditions. as we've heard and as we know, that COVID disproportionately affects people with underlying medical conditions. This is a slide from actually last September about the risks of COVID for people with different medical conditions and severe illness and death from COVID. If you turn this round and then talk about the vaccination, this is why it's really crucial for people with underlying conditions to have the vaccine. I'm just going to pick out two conditions that I've been asked about recently. So people with autoimmune conditions such as rheumatoid arthritis, we would sometimes usually advise people with autoimmune conditions to be wary of live vaccines. And live vaccines are vaccines like MMR and BCG. But as Vanessa has stated, the vaccines, all the approved vaccines are not live vaccines. So they are safe to take if you have an autoimmune condition. The other types of people that are on anticoagulants, so things that thin your blood, such as warfarin, there's some worry about that as well. But again, the British Society of Haematology have come out and stated that the vaccine is safe for people on anticoagulants, particularly if you're taking warfarin. It might be advisable to check your level, so your INR level, before you have it, but that shouldn't stop you from having it. Next slide, please. So there's quite a lot of interest around vitamin D as to whether or not vitamin D can help prevent or even treat COVID-19. The UK government's advice before COVID, before March last year, was that everybody should supplement during the autumn and the winter to maintain muscle and bone health. There was a study done in 2017 which showed a modest reduction of respiratory tract infections, of which COVID-19 is, when you're taking vitamin D. And it was actually a large trial of about 11,000 participants. So there's been a lot of debate about that, and the NICE guidelines have been revised now to take that into account. They've said that people should consider taking vitamin D supplementation throughout the whole of the year if you are high risk of being deficient. So that's people that are not getting much sunshine, people that live outdoors, people that have black skin. The current advice from NICE is that we should not be offering vitamin D to solely prevent or solely treat COVID-19. So that's where we are currently with vitamin D. There is no strong evidence that it will stop you getting COVID or it will treat COVID once you have it. Next slide, please. Just a few other questions that I've been asked in the last few weeks with regards to the vaccine. So the first one, I've had COVID, do I need the vaccine? Yes, you do. The immunity you get from the infection is variable, and we don't know how long it'll last. Vaccination augments this and will probably provide greater immunity than from natural infection. Can I still get COVID after having the vaccine? The vaccine is not 100%, no vaccine is, so there is a small chance. It also takes 3 weeks for you to build up your immunity after the first dose, so it is possible of infection after that first dose. I'm low risk, so I don't need the vaccine. Yes, you may be low risk, but that doesn't mean you're no risk. And there is a possibility that you can become unwell and end up in hospital from COVID. And we're seeing now more and more people in their 30s, 40s, and 50s, particularly during the second wave, who are ending up in hospital and requiring further support. The other aspect, which I'm seeing more and more of, is this phenomenon known as long COVID, where people are really debilitated for months after the infection. I'm seeing people who are tired, I'm seeing people who are breathless, I'm seeing people who are very, very debilitated by this. And it's thought that about 1 in 10 cases of infection can result in long COVID. So it is advisable to have the vaccine. The last question, if I decide not to take the vaccine, it doesn't affect anybody else. That's not true. To end this pandemic, we really need to achieve herd immunity. So we need a large proportion of the population to be vaccinated. By vaccinating yourself, you are protecting yourself, but also you are protecting those that are around you as well. Next slide, please. So I'm going to now talk about the myths and the misconceptions, and I'm not going to spend some time on this because Vanessa expertly covered this really, but this is probably the most damaging part of what we're hearing, these myths and misconceptions. So the vaccine does not contain any meat products. It doesn't contain pork. It doesn't contain gelatin. The vaccine doesn't contain a microchip at all or any other tracking devices. The vaccines do not alter your DNA. The Pfizer vaccine and the Moderna vaccine are mRNA vaccines. That is completely different to DNA, and it does not alter your DNA. And then Vanessa has covered the point about alcohol. There's trace amounts in the AstraZeneca vaccine. There's more alcohol in bread, more alcohol in a banana, for example. Next slide, please. I was going to show a video. Yeah, so I'm now going to show you a video of someone who's actually took the vaccine last week. You can play the video now.
Over 75, and I've just had the COVID vaccine a week ago. And the results of it, I am asking all BAME folks to embrace this vaccine, and when your turn comes, please accept it and take it. The reason I'm saying this is because there's a lot of scaremongering amongst us blacks, and we need to take it to protect our families, ourselves, and our families, friends, and the community.
So this lady is extremely valued, appreciated, and I do everything she tells me to do. Yes, it is my mum. And she had the same worries and fears that are really natural with anybody taking any medication, procedure, or vaccine. But what she did was she put herself in the best position to be able to make an informed decision and to have the vaccine. And that's what I would urge for everybody. Get your information from trusted sources and put yourself in the best position to make the best decision for yourself. Thanks very much, and I'm happy to answer any questions at the end.
Thank you so much, Dr. Zabaru. Thank you very much for sharing your family experience, especially from mom. Our love to her. And I'm sure what she said will encourage others who are still not. We got to do it. We got to make sure one is too many, and we have lost too many. And I think the emphasis couldn't be more than that. At this point, you'll be pleased to know that we have the poll results. It will give an indication for the remaining question and answer session so that we all know where we are as a community. Paul, would you mind sharing the poll result for us? It has no name, it has nothing. I'm sure you saw it. We just wanted to know what was your mindset before the session started, and hopefully we can better tailor our services to your needs. Do we have the poll result ready, or? The question that we did ask was, how likely are you to accept the COVID vaccine when offered? So we had 35% people saying they were very likely. About 14% said likely. We had 14% undecided, and we had 8% unlikely. What we want to be at, we want to get to the highest level of being accepting this vaccine. As I said, today is one of the many sessions that will be coming up, so we'll be encouraging you to join us when it happens. We want our community, our Black ethnic minority community, to be at a safer end. At the end of it all, we are in it together as a whole world, but we must also focus on what it is that brings us together and matters to us so much. We will move on to our next speaker, who will take us through a few areas that we all know of, we've heard of, but will make it a bit more specific to us. We have Dr. Adwoa Danso, a London-based GP and a board member of Ghanaian Doctors and Dentists Association, has many accolades in her net, but for the purpose of time, we will focus on the area she'll be talking on. Dr. Danso will seek to set out the risk factors of COVID-19 and look at areas such as workplace risk assessment, various vaccination groups, and hopefully take us through who should have the vaccine and probably when. So Dr. Danso, please take the stage for us, please. Thank you. I'm not sure. Yes, Dr. Danso is muted now. Thank you.
Unmute me. Oh, there you go. Thank you. Right, thank you very much for the very kind introduction. And it really is an honour to be on such an esteemed panel, and many thanks to the Ghanaian Union for organising such a needed conversation within our community. It's definitely necessary, and like I think Dr. Bola was saying, that we're in a position now where there is light at the end of the tunnel, and we need to grab this opportunity, because at the end of the day, with those statistics, we are the people that are most affected. So we don't want to see anyone else dying. We don't want to see any of our loved ones, our colleagues in ITU, or dying. This is an opportunity for us to change things. So yes, so I'm Dr. Danso. I'm a GP working in London. I'm also an executive for the Ghanaian Doctors and Dentists Association in the UK as well. And I have spoken on numerous panels, particularly with regards to race equality and mainly about issues that affect Black people, and I've written a few pieces for Women's Health, Cosmopolitan, Patient UK as well. So today I wanted to speak to you with regards to the risk factors for COVID-19. And I think I need to just simply explain that the way the COVID virus works, very, very simplified, is that it affects the respiratory system. And as it goes into the respiratory system, it sets up an immune reaction, which causes inflammation, swelling in the lungs. Now, if you have been unlucky enough to have COVID, you will know that you will be very breathless. Even simple things like lying on your back is such a challenge because your lungs are completely clogged. So when we try and look at risk factors, we're looking at things that already makes these things difficult already. So people who already have breathing difficulties, for example. Now, there are two sort of main large groups, okay? So we have people who are high risk, and I think Dr. Sabari mentioned in one of his slides, so people who are over 60, and then people who have diabetes, high blood pressure, chronic kidney problems, asthma, as I said, breathing problems, and obesity. Now, you can't really do much about being over 60, but you can certainly do a lot of things about your other conditions that you might have, such as diabetes, high blood pressure. This is the time, if you haven't been very good with taking your medication and haven't necessarily taken your medications every day, this is the time to get on top of your diabetes, take control of your blood pressure, and just be better with your medications or your inhalers as well. Obesity, I think this is also something that we must mention. We're in lockdown already. People are less active than they have been. People have gained weight, but let's also make use of this time. Let's also force ourselves to go out, get some exercise to try and keep our weight really nice and healthy. And I think one of the other things I would say is, I would recommend you all get a blood pressure machine, because that's one thing that you can do at home to make sure you are staying as safe as possible. So blood pressure machines don't have to be particularly costly. The one that I use for work, I got from Amazon for less than £25. And I recommend that you just get hold of one to monitor your blood pressure. And if you have parents, for example, it might be a good idea to purchase them for your parents too. Now, that's the high risk category. And then we move on to the sort of extremely high risk category, or the clinically vulnerable category. So what I would say is this is slightly more specific. This group would have likely have received a letter from the NHS. I think 2 letters were sent out. The most recent was at the start of the year. Now, this group of people are extremely vulnerable. So that simply means that if they were to catch COVID, their outcome would potentially be extremely poor. So these people would include those who are have cancer, who are actively going under treatment, such as chemotherapy. So chemotherapy essentially reduces your immunity, so it's harder for you to fight off infection. And also those who have recently undergone any type of transplant. Again, because as part of the transplant, you would have to be taking medication so that your transplant organ succeeds. And then we go on to other things like severe lung conditions. So again, as I said to you, COVID affects the breathing system. So if you already have a weakened breathing system, if you suffer with severe asthma, severe COPD, then again, you would be affected more. And then we've got a few other things like sickle cell disease, which is very prevalent within our community as well. So most of these people would have received a letter from the NHS, or would have been advised from their GP or their consultant. And I think I also should mention chronic kidney disease as well. So people who are either having dialysis or are waiting to start dialysis as well should be in this category. Now, if you're unsure about whether or not you are in this category, I strongly recommend that you speak to your GP or your specialist as soon as you can, because these are the people who we are really trying to protect. These are the people who really should be staying at home and not doing anything. So if you are unsure, like I said, please contact your GP or your hospital specialist for more information, and ensure that you are kept as safe as possible. Now, other risk factors. Now, we can't talk about COVID without speaking about the fact that race is a huge factor. Now, race is a factor, but also racism is a factor. And I think we cannot talk about this situation without talking about that at all. Black African people are the most affected people with COVID. They have the worst outcomes. They are the ones that end up in ITU. They are the ones that unfortunately die. And that's something we have to bear in mind. And I think that's kind of been echoed with previous panelists. We are the ones that are dying. So come summertime, like Dr. Bola said, rightfully, yes, the deaths would have gone down. Yes, the cases would have gone down. But when you look at those figures, it's, if we don't do something about it, we will be that number of people. We will be the people that are most effective. And also men, again, are more likely to die than women as well. And then finally, which, in terms of other more at-risk groups, healthcare workers, frontline workers, key workers, teachers, any public-facing workers are more at risk because you were just more exposed. So with that said, I'll move on to sort of risk management. Now, the best way and the best thing that you can do to reduce your own risk is to have the vaccine. There's no two ways about it. Having the vaccine will give you some protection, up to 95% with some of the vaccinations. Now, that after 2 doses. Now that is a pretty good protection for me anyway. So the best thing to do to reduce your risk is to have the vaccine. And also, I think just a word about following the guidance. Now, in my surgery, I've had a number of people of African descent ask about traveling for various things, traveling for funerals, traveling back home. Now, what I would say is that I would really strongly avoid traveling, because we know that you'll be mixing with people, no matter what guidance there is on the plane or with checks, you will be at more risk than if you were to stay at home. So that's just a quick word about avoiding traveling. Now, with regard to the vaccine schedule, there are currently 9 priority groups. And now this is based on age, occupation, the medical conditions that I had previously spoken about, but not currently on ethnicity. So at the moment, there are a number of groups who are putting pressure, including the BMA, who are putting pressure on the government to include Black people into these priority groups, because as we have said, we are most at risk, so we really should be prioritized for the vaccine. Now, what I would say and what I would encourage is every single GP or GP practice in this country has, if you are registered, have already been allocated to a group. Now, it would be good to know what your group is if you don't already, but there is advice online so you can kind of work out what your group is. And that's the order in which we will be vaccinating as well. If you aren't registered with a GP, I urge you to. And I appreciate that there are some groups that may feel anxious about accessing healthcare for various reasons, including immigration status. But there are lots of groups that can help you navigate the healthcare system if for any reason you are feeling anxious. So I strongly recommend signing up with a GP practice, because you don't want to miss out and be less protected as well. Now, final words. If you are working in a situation where you feel that you are not safe and you are not protected, you must speak up. You cannot put your life at risk for somebody else. That's the bottom line, okay? So your employer has a duty to protect you in the workplace. So you must speak to them if you feel that you're unsafe. You must speak to them as well if you feel that you have any of these medical conditions that may affect you at work. So I must say that you must speak with them. But even still, your employer has to complete a risk assessment. It's the employer's responsibility to assess your safety at work as well. So for example, if you are able to work from home, your employer should allow you to do so to protect yourself. If you need to have additional PPE, masks, gloves, aprons to perform your role, your employer has a duty to do that. If you need to be working in an office because you're not able to work home, your employer must make sure that your desks, for example, are socially distanced. And as well, if you are working from home, your employer is also responsible to ensure that you have a safe workspace environment as well. Now, all I will say is, if you need more information, gov.uk is a reputable source, and it has lots of information about the groups that I've spoken about the medical conditions that I've spoken about as well, and also with regards to the vaccine. And I know that we're going to be opening up for questions as well. And also, if you have any questions about the vaccine, I have a social media page called @theclinicdiaries, all one word, where I do post regularly with regards to the vaccine and also general the device too. So have a look on there too. Thank you very much.
Thank you so much, Dr. Ajua Danso. Thank you very much for sharing your knowledge and experience with us. We are mindful of time, so we will move on to the next panel. The next panel, is it full screen? Yes, okay. My next panelist, by the last but not the least, please, we have Belinda Danso Langley. Belinda is a community pediatric service lead for a London borough, managing immunization task force, consulting with pediatricians in child development services. Belinda will take us through some of the anti-vaccination messages that are out there that we must all be mindful and aware of. And then we will lead on from there to simple questions that have come through, and then hopefully we'll move on to the Q&A. Thank you. Belinda, please take over.
Thank you. Thank you so much, Emmanuel, and thank you to my esteemed panel members who have come before me. Now, Emmanuel had said earlier on that I am going to have to leave at 8:30, so I probably won't be around for the questions. And the reason for that is, I mean, this is very real for me. 4 times a day, we are logging on together collectively, and we are counting numbers, but the numbers are people. So we're counting the numbers of people who've been admitted to our wards, the numbers who've got COVID, and the numbers that hopefully at the end of the evening, I can say have been discharged rather than those who have passed away. And quite a large proportion of those are Black and ethnic minority groups, and there are Ghanaians amongst that too. So it's very real for me. Paul, are you going to share the slide? Mine is very, very brief, and is only 2 slides that I've got. So in the introduction, Emmanuel mentioned that I lead the vaccination team for my borough. And, you know, vaccinations are not new. We've been vaccinating, you know, from 1914 and beyond. We are doing it for babies. We are vaccinating adolescents, school-age vaccination, and also for older people who routinely, if you're over 50, you probably would have got your letter this season back in October to go and have your flu vaccination. So vaccinations are not new, but the COVID vaccination, it will be new for everybody. And it's completely understandable that people will have questions and will have some hesitancy towards the vaccine. That's completely understandable. And I would not dismiss any question that anybody had about the vaccine. The part that I really wanted to highlight to everybody really is where some of these anti-vaccination messages are coming from. So I'm not here to convince you either way. It's really just to urge you to check your sources when you get some of this information. Paul, the next slide, please. So while Paul is pulling that up, right, there we go. So there is one, and this is one of many, and I'm not going to show any more other than this one because I don't really want to give it too much air and space. This is one of many that I get in my post bag. I get it at work. And this one is talking about COVID-19 causes autism. We're not even administering the COVID vaccine to the pediatrics. We're not administering it. So this is one that was on, I think it was on Twitter, and then it was posted to me. Now, what we noticed was that they're sharing this stuff on Facebook, Instagram, Snapchat, and they're actually targeting our community. Because they know that there is a long-held mistrust towards health, and there has been health inequalities that towards Black and ethnic minority groups that we can't deny. For example, the mortality rate for Black mothers in childbirth is higher than it should be. So we recognize that there is mistrust there, but so do the anti-vaccination groups, and they're targeting us. So some of the theories that have been going around is about the Bill Gates effect, there's the 5G, there's the government-controlled chip that one of the doctors mentioned earlier on. None of these are based on any facts at all. So who is sending this information and why? there are groups, and then there are individuals who believe strongly against any vaccine, including the COVID. So there are some particular groups that have sent me information and have threatened to take my service to court over the flu vaccine. And then when the COVID vaccine came out, the same group started sending information about the COVID vaccine. So I would just say, ask questions, get the accurate information, and make the decision based on facts rather than fear. If you get something in your WhatsApp, verify the information before you pass it on. If your brother or your sister is sending you something, you're not really going to check too deeply because you have that inbuilt trust. And so you're thinking, okay, so my brother sent me this, there must be some truth in it. So I would say to all our community, before you pass this information on, just check your sources. Now, one of the examples I gave earlier on was that there was a Ghanaian nurse that actually said to me, I asked just in passing, because we'd done a poll in our trust and we realized that the numbers of our Black nurses actually taking up the vaccine was quite low. We did it again a few weeks later, and then we found that it had risen. But in all the forums, Black nurses were still saying, oh no, we're not going to go and take the vaccine, when we know that some of them actually had, but they were fearful about the backlash and how other family members and other people in the community were going to react towards them. So they didn't want to say that they'd taken the vaccine. I would plead to those of us who have taken the vaccine, be honest about it. If you had a sore arm, like some people have said, and that is very real, tell people that, yes, I had the vaccine and I had flu-like symptoms for a few days, but I'm okay now. Be honest either way. We're not saying tell people that you had it and everything was brilliant. Tell the truth either way. Just be honest so that other people behind you who go and take it can appraise what could happen. And the worst that's going to happen is the flu-like symptoms. Some have been very tired, but within a few days, you're okay and you're protected and you're back to normal. The very last thing that I will say on checking your sources, a Ghanaian nurse said to me, well, I'm not going to take the vaccine because, well, the numbers are only 438 in Ghana. We live in England. So though the numbers, and I don't even know if this number is correct for Ghana, but if you're looking only to Ghana News, Ghana channels, Ghana radio for your information, and you live in England, it's not really realistic on your situation in England. So I think, again, check the sources and make the decision based on fact and definitely not from fear. I will hand over back to Emmanuel.
Thank you so much, Linda. Thank you so much. As I'm sure we've now all heard, we've listened. The experts has given their opinions of what they know and knowledge-based facts. I think we're going to run a quick poll again to see where we are from the first one we did, the one or two, just two polls. It will take just a second for you to do that, and then we'll move on to some of the pre-event questionnaires that we received, and then that will take us straight to the chat rooms and all the other questions that we've received. We'll run the second and the third. Again, there is no names. You don't need to put anything. You just need to click the button. We want to try and gauge where we are as a community, as a people, so that going forward, we know where we can tailor this. And again, I want to make it clear that all these people, all these rather good people who have volunteered their time to talk to us are doing it for free. We couldn't be any more thankful. They've all finished. Some of them have done 12-hour shift today and still continue to another 2 hours for the sake of our community. There is no money-making exercise here. We as a community organizations, we are not getting anything out of it. We just want to make sure that we don't lose another person. We've lived through 8 to 9 months of last year, sitting at home, worrying about how we're going to come out of it. Now the solution is somewhere halfway. We all need to now get our mind back to where we're supposed to be and make decisions that we think will help those around us. I guess the polling is done, and we will move on to the queue, some of the questions that we have received before this session started. And by no particular order, I will encourage all the panelists to feel free to unmute themselves if they believe there's a question that they will be able to answer from their side. First question that I have here says, will someone be immune to the virus when you have taken the first dose of the vaccine, or you need to get the second one before you can become immune to the virus? I believe Dr. Zabaro touched in a bit on that. I don't know if you want to comment briefly on it. It has to be brief so that we can move on to the wider Q&A.
Yeah, sure. So the majority of the immunity is got from the first dose of the vaccine, but it takes about three weeks to get that immunity. You do need the second dose to give you the maximum immunity, though. But the majority is got from the first dose, but you do need the second dose as well.
Thank you so much, Doctor. The second question is, what is the possibility of not dying after taking the first dose if I get infected before the second dose? Is any of the experts can...
I'm happy to take it. So I think it's again that, as Dr. Zabari said, is that after you have the first dose, you get a certain level of immunity, but it's really important to take the second dose to be fully protected. But when you take the vaccine, what's really important is that it reduces significantly the risk of you getting severe disease or dying from COVID, but it reduces it significantly, but it doesn't take away the risk of getting COVID. So that's just an important distinction there as well.
Thank you so much, Dr. Vanessa. The third one is, if I get vaccinated, can I stop wearing the mask and social distancing completely?
Okay, hands, face, space, and vaccine. That's my advice.
Thank you. The fourth one is, what effect does the vaccine have on a person of childbearing age? Again, that was highlighted. I don't know if any of the experts will want to readdress it quickly, please.
Yeah, I mean, I touched on this. There's no evidence that the vaccine affects fertility of men or women. And in pregnancy, there isn't the data yet. It's not to say it's unsafe in pregnancy, but they're recommending that pregnant women don't routinely have the vaccine unless they're in high risk positions where they're likely to catch COVID, or they have a high risk condition or an underlying condition.
Thank you, Doctor. The next question is close to me. I want to make sure we the men who are dying a lot can be given can the vaccine cause sexual dysfunction? It's something that is bothering men a lot in the community.
So I suppose I specialize in sexual health, so I'll answer that. No, there's been no evidence to suggest that that is the case. What I always say to people is that if you get COVID, the higher risk of you having difficulty enjoying sex afterwards because you have been unwell, when you're tired, etc. But the vaccine itself, there's no reason to suggest, and there's been no evidence that it will affect sexual function or pleasure.
Thank you, Dr. Vanessa. The next one is, if the virus can still kill you anyway after your first dose, in between the first and the second, why would I need to get vaccinated, and why should I bother? If you can still get it.
I'm happy to take that. I mean, I think it's kind of echoing very similar things, but ultimately it reduces your chances of dying and reduces your chances of hospitalization. So all of the vaccines, whether it be Pfizer, whether it be AstraZeneca, whether it be Moderna or Novavax, they all reduce your chances of hospitalization or death. Now, I mean, I think it's just obvious. Why wouldn't you want to reduce your risk of dying? Quite simply. So, you know, yes, you are still, you know, there is still a chance of you catching COVID, but there is a reduced chance that you're going to have horrible symptoms and end up in ITU and you know, dying as well. So I think most people would rather have a slight cold if they were to catch COVID again than the, you know, the horrible scenarios that I've mentioned.
Thank you, Dr. Ajua. Thank you so much. The last one, but not the, I mean, I've got last but one. Is the government responsible if I get any reaction after taking the government-approved vaccines?
I'm happy to take this because I think this really is part of the crux of why people are concerned about taking the vaccine, and which I'm really respectful of, because we're here as healthcare professionals, because on a personal note, what I've seen and what I've experienced within extended family, etc., I don't want to see again. And so I feel that vaccines are key to that. But the concern about, you know, what happens to me if something goes wrong and will the government advocate for me, I completely understand that concern. What I will say is that we are being seen, we are valued, and there are people like ourselves here that are advocating for our communities. But the key thing is that we have to speak up. So if we do have a negative experience or there's anything that you're concerned about, please let your GPs know. Please let the healthcare professionals that you interact with know so they can advocate for you. And that's what I would really emphasize. I know there's mistrust there, but there are people in society that are there advocating for us. So I'll just end there with that.
Thank you so much. I have allergies. Can I still take the vaccine? That's the last question I have on my end.
I'm happy to do that. So in terms of the allergies, one of the concerns was very early when Pfizer came out, there were a couple of people that got an allergic reaction. Now, what happened was that the study stopped, which is really appropriate because, they stopped giving it to people that had a history of allergy. And that was really important because it shows that they just didn't continue. They just stopped they stopped giving it to people with a history of allergies to then assess and work out if it was the right thing to do. After assessing it, it was recognized that even if you've had a history of allergy, in most cases, you are able to take the vaccine. There are very few cases in which it is not appropriate for you to take the vaccine. And so if you have an allergy to anything, please let the people that are giving the vaccine know so they can give that decision. What I'll say is that in my slides, I highlighted what the vaccine is given in the injection. And there are some molecules, a very small percentage of the population are sensitive and allergic to this. And those are the situations in which you couldn't take the vaccine. But for most people with a history of allergy, you are.
Thank you so much. You'll be pleased to know, thank you, Dr. Vanessa. We'll be pleased to know that our poll result has come in. And from 14% from the first poll, the question now was, has today's session met your expectation? We had 49% of people saying yes. Yes, it has. 41% saying yes, some of my questions have been answered. The second question was, would you consider accepting the vaccine when offered after this session? We have 63% saying yes, and 17% saying likely. We have 3% saying very unlikely. So we are making progress, and thank you all for putting your questions to us. I will be handing over to my partner in moderation to take over the questions on the other side.
Emmanuel, so sorry. Before you do, I've got to go for my COVID bronze. So thank you to my panel members.
On behalf of the community, I want to thank you for your time, and we will rely on you for many other opportunities of this nature. Thank you.
Thank you so much. Good evening, everybody.
Hi, good evening.
Yeah, good evening. And I will be handling the questions and answer session. I've been following all the questions coming on live on Facebook and on Zoom, and I will just pick out some have been addressed in the sessions as they were delivered, So I will go straight on and bring those that have not been sort of clarified so people are clear. It's quite clear people are very passionate about everything to do with COVID. So I will just get the ball rolling. There is a question from Martina, and she is saying that in UK here, the government has decided to widen the gap for taking the first and the second dose. And she wants to know why that is. Is it to enable people to just take the vaccines, or is it going to be in the best interest of everyone? So I will let someone answer this question. And then there are 4 hands up. So I'll try and go to the people who have raised their hands so we hear from them. Is anyone happy to take this question? Why the gap?
Yeah, I mean, the trial data, the Pfizer vaccine was looked at a dosing of 3 weeks between the first and second dose, and the AstraZeneca was 4 weeks. But our government took a decision that to prioritize the first dose. And the reason for that is really to protect as many people as possible. This is a public health issue, trying to protect as many people to give them the first dose possible as soon as possible. We know that you get the most immunity from the first dose. So by prioritizing that first dose, we're probably likely to save more lives.
Oh, thank you. I hope that answers your question, Martina. So there is this person on live, Geraldine, who is very passionate about the sort of questions she's asking. And she wants to know, we keep saying the Black community are dying. She wants to know, what are the statistics to suggest that indeed we are really dying? And I think I'll probably link it up to another question, which says about the vaccine uptake, that again, we are not taking the vaccine as Black ethnic minority people. What is the statistics so far on the vaccine uptake, especially to do with the BAME community?
I'm happy to discuss that. So with regards to the statistics, I think it was mentioned earlier as well, but Black African people are 2.7 times more likely to die of COVID than their white counterparts. Now, if we look at the uptake, new data came out earlier this week or over the weekend with regard to the uptake. And at the moment, we are behind. It's approximately, we are 2.5 times less likely as Black people to take the vaccine compared to white people. And interestingly, mixed race people or the mixed category are 3 times less likely to take the vaccine. I was somewhat surprised. I expected I somewhat surprised because I expected that Black people would be slightly worse in taking the vaccine than mixed people. But what I would say is you have to kind of take that, data is something that can be, extrapolated to kind of fit what you want it to fit. I think it's more important to look at the number of people that have actually had the vaccine and look at the proportions of those people being Black as well. I've had the vaccine as well. And I think looking at media, when we look at the types of people that were shown on TV having the first, the second vaccine, they were not Black. And I also think that puts something in us to think, well, actually, no, this is not for us. You're not seeing people like yourself having the vaccine, but people are having the vaccine. So instead of sort of looking at the numbers at, are people hesitant or not? Like it was mentioned, I can't remember who the speaker was, but people are not always honest about whether or not they've had the vaccine. So I think it'd be more interesting to look at the data the other way, look at the proportion of people that have actually had the vaccine and look at how many of those people were Black.
Right, so a number of people have their hands up, and I think I'm going to go down the list. But before I do, there is a question on one viewer on Facebook, Steve Molindra, and he is asking that at what age are children at risk of catching the virus? And if they really do, then another question I could just add on is, are children going to be eligible for taking the vaccines anytime soon?
I'm happy to ask that. Yeah, I'm happy to answer that. So anyone at any age can get COVID. Now, what we saw in the first wave was that we saw that when children were getting COVID, they were getting really quite milder disease. And so I can say, you know, that sneezing or a mild cold flu-like symptoms. But what we are seeing and we are learning more is that children are definitely being affected, and we are learning in terms of how how it is manifesting in children. And I don't know if people have seen, but there's just been some evidence that some children, unfortunately, have had quite severe complications as a result of having COVID. So very much so, anyone at any age can contract COVID and can have complications. Now, with regards to the vaccine, at the moment, it is 16 and over. Again, similarly, because the vaccine has not been tested in pregnant women, again, because it wasn't tested in children, that is why there is the cutoff. But there is studies ongoing, and it's said that later this year, and maybe by the end of spring, we will have data and more guidance as to whether children and when they will be vaccinated.
Thank you very much. So just to say that for those of you who I'm going to let in to ask your questions, just please be brief. Just go straight to the point with your questions so we can take in a whole lot from others as well. So I'll let in Moses Nyanu. Moses, are you with us?
Okay. Yeah. Can you hear me now?
I can hear you.
Yeah.
Go
Okay.
ahead.
I'll be very brief. I think most of you would have remembered last year, probably around May, June, when that young Ghanaian woman who was pregnant and died in, she's a nurse. She was a nurse as well, and died at Luton Hospital or somewhere in Luton. Now, because the fact that she was pregnant fed into the theory of people being affected when they are pregnant and all those kind of things. And one of the issues that came up on social media very strongly was Kenyan women who apparently have been vaccinated for not COVID, but other things. And lots of them were becoming infertile or something like that. Now, the reason I'm mentioning this, and then I will add, just to make my thing brief, is gene 5G, its effects and all those kind of conspiracy nonsense and so forth. Personally, I spend a lot of time reading about this gene 5 and then about Bill Gates. And what I want in our future meeting is for our doctors or our specialists to take some of these things head on. One, at least if you take one, I know there are so many questions people want to know, so that we address it. For instance, is it true that in Kenya, this thing actually happened? Is it true? It's part of the theories that we have been hearing on social media that scares a lot of people. And the fact that a Ghanaian woman, a nurse, died in Luton Hospital, it was at the front page of the most papers at that time. So it fed into all these kind of narratives and so forth. So please, in future, when you come in, you could take some of these 1 or 2 examples and hit them head on, because we are carrying the messages back to our colleagues. Yeah, that's all I want to say.
Right, that point well noted. Anyone has anything to say on that?
Yeah, I'd like to just say thank you very much for your comment, Mr. Nirabi. Sorry, I lost your last name. Now, yeah. I think I want to just respectfully highlight something here. Now, you've addressed something with regards to some women in Kenya who took something, who have had infertility. Now, my question to you is, what are the details of that? I mean, I personally have not heard that, but what vaccination did they take? Where did you get that information from? What were the sources, and were they reliable sources? So that's my question to you now, because I want to know more about that, because that's very concerning. So where did you see that, and what vaccination was it?
I think I have seen that kind of that publication when I started reading about the vaccines before they actually came in. So it is definitely a publication, and I think it was highlighted in a publication even under World Health Organization. So I think for the next session, I'll probably just try and find that, and that is what he's referring to. So it is not the first time I'm hearing this, but I would say that probably we can look into that. And like he suggested, try and just get rid of some of the myths, especially to do with Africa, because in that same publication, there was something on Nigeria and then to do with children who were vaccinated. So it's stuff that did happen in some parts of Africa, but then we are really focusing on the COVID vaccine. So it was just to note, but not really tied to this COVID vaccine as such, but we can address that in the next section, I think.
I'd be really interested to, I mean, I can always share my email, because you know that I would love to know more about that, and I feel I should have that information to be able to report back.
I will definitely find it, because I've done a program on it where I read and took note of that particular publication. So I will find it and forward it to you, so we can look at some of these publications to allay people's fears. So if we can move on and go on to the next person, Jude Sentongo Kafiro. Jude, are you here?
Yes, I'm here. Can I be heard?
Yeah, Jude, I know you've been asking a lot of questions on the chat. So if you can please be brief, because
yes,
I have noted a whole lot of questions from you, please.
Yes, ma'am. I'm going to be brief. Thank you very much.
Thank you.
My question was just very clear, because the presenters, I appreciate the information, but just is that they
you are having a lot of feedback, a lot of noise in your device. Can you hear us?
Yes, I can hear you. Can you hear me?
Okay, and if you can speak up as well, please, Jude.
Okay, can you hear me now?
Thank you. I can, thank you.
Okay, my question was, the presenters have presented everything in a very abstract way. My question directly was, what vaccine are we talking about specifically? Are we talking about the Pfizer vaccine? Are we talking about the AstraZeneca vaccine? And which variants of the COVID are we talking about? Are we talking about the South African variant? Are we talking about the Brazilian variant? That's my question. Thank you.
Okay, does anyone want to take, I think it was an overview on all the vaccines. Anyone wants to answer him, please?
I'm happy to start, and then others can come in to do that. So no, thank you. I think that's really important. I think there's an underlying message that we have about vaccines in general, but it is important for people to understand the specifics of it. So there are a number of vaccines which have been authorized and signed off, and there are more ones coming through. Each vaccine has a subtle difference in how they tell the body to make antibodies against COVID. Now, when we talk about, I think, sorry, Judy, you were saying that how do we, the characteristics of each of the different vaccines and the different variants. I think not to just oversimplify it, but just in the interest of time and just to tackle it, is that what we know is that the vaccines that we have at the moment give us a certain level of protection. And that protection definitely is better than having no protection. Now, we are learning more. And the thing about the variants, which I really want to say to everyone, we are not surprised that we are getting variants. As viruses multiply, they change, and it is expected. And in fact, it's powerful that we have the technology to recognize that there are differences. But what we know with many of the vaccines that we have, whether it be Pfizer, AstraZeneca, or other ones like Moderna that are coming out, we know that for many of the vaccines, for all the new variants coming, that they will offer some degree of protection. Now, the other thing to say is that we are still learning. So it may be that we have given, it may be that we have the vaccine now, but because of the variants coming out, we may need a top up of a second injection in the future. Very similar to the same way with the flu vaccine, we have a yearly. So the vaccines at the moment give us a certain level of protection, and as we learn more about the variants, it may be that we change how we manage it. In terms of, I can see relating to that in terms of the specific different vaccines, what I may do, just because of the interest of time, I'll put my email there and I can send specific information about each of the vaccines, because they do have subtle differences, but overall, they offer the same level of protection that we need. I'll do that.
Yeah. So based on your answer, I've got Rose Mondia watching on Facebook through Omega Live TV, and she wants to know, how does one choose which one, or do you just take it because it's been offered? Is there any criteria for making a choice in the vaccine you have?
At the moment, the way that it is working in the rollout, and we're doing a lot of work on this, is that it really depends on your area and the one that you're offered by your GP or any other setting. But let's say for East London, we're doing a lot of work. So because some people, when you say that you can have access to the Pfizer vaccine, they're reluctant and concerned. And they say, actually, no, I've read it. I've done my due diligence and I want AstraZeneca for their own particular reasons. And there is opportunity that if you want AstraZeneca, then there are places that you can go and access it, like the Excel Center. So if you are concerned and you say to your GP, I don't want this particular one, they can explore with you other places that you can access a different one. But generally, you have access to the one that your GP or other healthcare professional offers you.
Yeah, because we have people tuning in from all over, I think I have to probably take a question coming in from Ghana, because I think it will just generate an interest going forward for those watching from other places. So I have Alice Amwa-Kotemeng, and she wants to know that she says in Ghana, COVID is everywhere, but in terms of the vaccines, what ones are they going to have? But I mean, this one, I don't know whether we can even answer that, because we do not really know what type is going to go to Ghana. She says Ghana, COVID is all over the place, but for the vaccines, are they different from the ones being administered abroad? And how is it true? And if it is, why?
Can I try and answer that? I think the thing to say is each government makes the decision about which vaccine they're going to make available in their country. And every country will have their own medicines regulatory authority, like we have the MHRA in the UK. Each sovereign nation should have their own, medicines regulatory authorities who will make the pronouncement in terms of which vaccine they will authorize or not. And it's also up to individual nation governments to decide which vaccine they're going to buy into their country. So it's not a question that we can answer, to be honest, because that will be within the remit of the Ghanaian government.
Yeah, absolutely. And if I can take the next question from Charles Quist, please, Mr. Charles Quist. You've raised your hand. Are you there? Right.
Yeah, I'm here. Yeah, my question is got to do with COVID complication, if I should put it that way. I'm a healthcare professional and I had a COVID infection somewhere in November and since been recovered. But then I have been experiencing anosmia and cannot smell anything up to now. And I want to know what can I do to, overcome it? Because even if somebody is around me and fat, I can't smell. If I'm boiling
that's
rice,
a good thing for you.
If I'm boiling rice and it's burning, I can't smell it. I don't know what to do to overcome it.
Mr. Quiz, that will
any,
probably help you in your occupation.
yeah,
No,
if,
can anyone take that on, please? How to manage, and I'll generalize it, how to manage any long COVID, like post COVID complications. Is there anything that can help people?
Yeah, so I think Dr. Vanessa mentioned this, but you know that these are sort of classical symptoms of what we are seeing as long COVID, and you know we are still learning, we are still seeing the effects of COVID because it's so new. But the good thing about it is that we are, well, the NHS are commissioning specialised clinics to see people with these symptoms of long COVID. So at some point, I mean, I think first of all, you should definitely discuss this with your GP if you haven't already, just so that they can keep a note of your symptoms, because it's important so that we have a clear timeline of what's happening with you as well. So in the future, I'm not sure how soon, but there are definitely long COVID vaccines specifically for people that are having the effects of long COVID, which really does vary from person to person. You know, people have had symptoms like yourself, people have symptoms of extreme fatigue, exhaustion, joint pain as well. You know, and as I said, it's new, it's still evolving, so we are still seeing these new symptoms, but I think it's really important that you report these symptoms so that, you know, we get to know what things are becoming more frequent, so we know how to tackle them.
Can I just follow up on
Thank you. Right.
Can I just follow up on that? So from an NHS England point of view, that's exactly right, that we have commissioned long COVID services. And at the moment, the main focus is around assessment and trying to understand the different types of symptoms that people are still experiencing. The data is going to be incredibly important, because the more people come forward, the more we will understand the range of symptoms that people are struggling with after the initial infection. So I will encourage you, yes, indeed, to go along and see your GP. And if they don't mention referral to the long COVID service, I would also encourage you to prompt the conversation and just inquire about being referred, because that starts to build our body of evidence. The other thing is, I will refer you to go onto the Your COVID Recovery website. This is a website that has been developed in collaboration with Leicester. And it's a really good platform. There's tons of information on the Your COVID Recovery platform, and the more people use it and report their symptoms, the more we will learn the range of symptoms going on in the country. So two things. One is, yes, we have commissioned a long COVID service. Please go along to your GP, prompt the conversation about being referred, and go on to the Your COVID Recovery website for more help.
Right. I hope that answers your question, Mr. Charles Quist. Before I go to the next raised hand, I think we're getting close to the end now, and there are lots of questions still. But two people are making this observation that could the representation BAME debt be reflective of the poorer services that are offered to the BAME community by the NHS? Is that why we are dying so much? Could the overrepresentation of BAME debt be reflective of the poor service we get in NHS generally? Or is it just us being, could I say, naive and not seeking help timely enough?
Can I take that? So from an NHS point of view, the first thing to say is that we know that the incidence of certain long-term conditions, so for example, Black Africans are 3 times more likely to develop diabetes, and South Asians are 6 times more likely to develop diabetes compared to the white population. And as you saw in Vanessa's slides,
a lot of the long-term conditions that were referenced within those slides do tend to occur to a greater degree amongst, Black African communities. And of course, when you have those underlying conditions, they then increase the risk of severity of disease and the risk of death. So it's important that we do highlight that. And some of the more recent publications that we've seen are also indicating that apart from those specific conditions themselves, ethnicity in itself does confer a higher risk of severity and mortality. The final thing I will be saying is, as the Director for Health and Equalities in NHS England, I am absolutely committed to working with my colleagues across the NHS, Public Health England, Department of Health, to make sure that we increase our efforts to ensure equitable access, to give people an excellent experience and the optimum outcome that they can have, regardless of their ethnic background. So yes, we have a long history of perhaps people having different experiences of different services, but I'm just here to say my commitment is to make sure that as we go forward, and it's not just my commitment, the other thing I want to say to you is that by the virtue of the NHS appointing a Director for Health and Equality, that is a very powerful signal about the seriousness of the organization to get this right. But I have to say that's one side of the equation. It's one thing for the organization to appoint, a Director for Health and Equalities, and I would be working round the clock with colleagues on the panel, with colleagues all over the country. But we also need our communities to come forward and engage with us as we work hard to make things better as we go forward. I'm also asking you tonight to please commit to also work with us so that we can absolutely improve access, we can improve experience and improve people's outcomes as we go forward.
All right, thank you. So we have about 6 people who have raised their hands, but I'll start from the top. Is Linda there? Linda, are you still here? What about Cece Yorson? Cece, are you still here? Hello, Linda, is that you?
Yes, please. Yeah.
Okay, if you can be brief with your question, please, Linda.
Right. My question is, let's say you've had the first dose and you have to travel for a couple of months. And I think for having the first dose, it takes 2 months or so for you to have the next one, the second one. So what happened if I'm traveling for a while, like a couple of months? What will happen? Is it?
I'm happy to try and
okay.
clarify this. So
yeah.
So between the vaccines, it's approximately 12 weeks between the vaccines. So that's the first thing to clarify. I'm not sure if you were on the call when I was speaking, but I spoke, obviously, it's personal to you, but I spoke about the risks associated with traveling. With 1 dose of the vaccine, you won't be completely protected against COVID. So that's something that it's also important to keep in mind. Now, with regards to where you'll be whether you'll miss your slot, I think that might be part of your question. You said, it's the GP that would allocate your session or your appointment at the COVID centre. So what I would say is, if you really have to travel, then that fair be, but if you can stay, that would be even better, but I don't know the circumstances. The next thing I would say is it was probably worth speaking to your GP surgery as well. We know that the studies have shown that the best time to have it is that time. So I would strongly recommend that you said, I think you're away for 2 months. So if you can, be back in time to have it, I think that would be great. But just bear in mind that you are not completely immune or completely protected.
Yeah, and just to add on, everyone can take note of which vaccine they are taking as well, because I've had conversations with people who have said they've had it. I know here in the UK, you are given a card which states what vaccine you've actually had. But I have had this experience with someone elsewhere, and they didn't even know which vaccine they had. And obviously the research now doesn't confirm that it is safe to mix vaccines, not at this stage anyway. So please take note of which vaccine you are actually having, just in case you find yourself somewhere else and you have the chance of having another dose. This is just what I would add on, Linda. So please take note of that.
Add on, if you're not sure and you can't remember, because obviously some people might be a bit anxious when they go and might not remember. It's all stored on your GP files as well. So if you're not sure, your GP will be able to tell you what vaccination that you've had as well.
But more so people in other places, because this person wasn't in the UK, where we have been given cards and all sorts after having the vaccine, and it states which vaccine you've actually had. But I encourage them to go and ask the service provider what exactly they were given. And not just for that, obviously I'm passionate about health as a whole. So to take note of everything going on in your body, you can't just have anything, dished out to you without knowing what you are actually receiving. So that is just to note. So can I take a question from CC? CC, you were trying to join in. CC Austin, are you still here?
Yeah, I'm still here. Can you hear me?
We can hear you loud and clear. Go for it.
All right. I'm calling from Ghana, and the vaccine is not in Ghana yet. But I want to find out if you have underlying problems like pressure, diabetes. Can you go ahead and take the vaccine when it comes to our area? Yes. I didn't start the program, so I don't know whether it was answered or it's been talked about. Thank you.
So it will be answered, but take time and listen to all of it. There's lots of information, so you don't miss out. Yeah, anyone happy to take that?
No, just that, please, yes. In fact, we would really encourage that. So it's not to stop you, rather to encourage you to take the vaccine.
Yeah, absolutely. And there is a patient with a lot of, health issues who wanted to feature on here tonight, but I don't know whether we managed to capture her. Amma Folson, did you manage to join in? If she is not here, we will make arrangements, maybe so next time she makes a video like Dr. Abdul's mom did. So we sort of fit that in because I think her video will be very useful to allay the fears of people with severe health conditions. So can I ask Kobi Khan? Kobi, are you there, Kobi Khan? And Mr. Quayson, in the meantime, how much time have we got? Because we still have a few hands up. So whilst Kobi is getting ready to ask his question, so I know how far to take the remaining questions, please. Thank you.
Really, I wouldn't like us to overrun. I would rather have them come back again so that they can hear more, and also to release some of the experts to go and have an evening. We have next 2 weeks to organize a new one, so by all means they can join. But from there on, we can finish and round off.
Okay, so I will just have to apologize to Dominic, Kobi, Kofi, Abolegbe, Olu, Thompson, Amma, and Amma. I think Sister Amma is here, but we'll make arrangements so that we fit a video in, which will be more suitable, like Dr. Abdul's mom did. So I think that brings us to 9 o'clock. So Mr. Quayson, I think it's been an awesome session so far. And there are lots of questions that have not been answered, even on the chat. So I'll say that I'll take note of all your questions. So please tune in 2 weeks' time when we come, so we can get all the questions addressed as well. Thank you, Mr. Quayson.
Thank you so much. Thank you, Winnie. You did call Dr. Khan, and I'm sure, sorry, Kobi Khan, and he's also in the practice. So if you don't mind, Dr. Khan chipping in quickly, then we can round off.
Okay. Emmanuel, thank you for giving me that audience. Just wanted to say Thank you to all the doctors, all the panelists for that information that we've had. Mine is more of a contribution. Winnie would understand that we've done quite a number of programs on behalf of Omega Life, educating our community on Facebook. Now, one of the things I realize is that a lot of these meetings that we have usually is attended by people within the healthcare sector, people who can read, people who are educated. And I'm beginning to realize that the information that really needs to go to those at risk is not filtering down as information that can be disseminated to them. So for example, I'm taking my average brother or my mom, my auntie, the first generation people that I go to church with, who normally would not be on Facebook. They wouldn't be attending webinars, attending programs like this, would not have an hour or 2 hours to sit down and listen to a program like this. But they are the same people who have been exposed to all these conspiracy theories. And make no mistake, bad news affects people more than good news. It took me quite a lot of convincing to convince my own kid brother to accept the vaccine. And his point was that, well, the statistics and information I was presenting to him is because I work within the health sector. It is sites that government has given me, and I have to understand that not all that information is true. Our people have, I remember Dr. Bola saying that we must engage with our people in the community. They have ideas, they have concerns, they have expectations. If we're going to engage with them, one of the things that I would appeal to many of us who have the opportunity to educate them is that let us never be dismissive, okay? Because sometimes it is so easy to brush aside what they believe in. And make no mistake, they have beliefs, and that belief stems out of the experiences. People will talk to you about the slave trade, distrusting politicians, the Tuskegee experiment, the thalidomide experiment, and you can't dismiss these things as untrue. They have evidence. They would give you examples like the one that Winnie was talking about from Kenya that I read about as well. These are things that have happened, so they've got a bit of evidence. And I would be very surprised if anybody on this panel here did not read any of the conspiracy theories and did not find it compelling. It just happens that because that's right. And I'll be honest with you, there were times when some of the things that you read are so compelling, if you're not careful, even as a scientist, you're more inclined to believe. It's taken me a while to convince my parents to have the vaccine. And even that they came back, they wanted to know, what vaccine did you have yourself? And why should we go for the vaccine? Eventually, my mom went first. Daddy said that he wanted to wait for about 2 weeks until mommy had had it before he would go for it. And it took me time to then disseminate that information in the local language and explain why they need it. Many of the people that we are describing as at risk, the BAMI groups, are your ordinary cleaner, the healthcare worker, the bus driver, the hospitality worker, the retail assistant. All these are people who, unfortunately, you'll be very surprised, will not be listening to Sky, nor be listening to the statistics that you're giving to them. They would go to check, they'll be on their WhatsApp, all the videos that are coming. My question to us is that we have an influence in the community. Could we provide information that can filter down to these ordinary people that are at risk? If we can do that, then I think that we would get to so many of the people, 5 minutes, 10 minutes of videos or information in the local dialect explaining what the vaccines are and why they are at risk. For example, explaining to them that the job they do, being at the front line, the occupations that they carry a higher risk, not because they are Black, that is why they are dying of COVID, but the fact that they are at risk because of their comorbidities, they are at risk because of the jobs they do, they are at risk because of where they find themselves, and that it is important for them to have the vaccine and then debunk some of these myths. I think that would go far to help them. And finally, just a final point about why are people not engaging with the health services? 2 reasons. I have experienced that when I took my son to A&E, even before the person got to know that I was a GP. And that was when I put my foot down and I had to report him because his attitude was bad. And I told him that, look, your attitude towards me, because I'm Black, you're being very dismissive. If this was an ordinary person, an ordinary Black person who did not know what their rights were, they would have gone home and their child would have died. And I had to make it clear to them. that, look, I'm going to report you to the authorities because that is my local clinic and I attend PLT meetings there. And then he ended up apologizing for his attitude. And that's one of the reasons. Number two, my ordinary Ghanaian people who don't attend surgeries would tell me that the time that we offer the appointments, even including extended hours, because they have to juggle 2 jobs and 3 jobs and 4 jobs. They don't get access to the GPs over the weekends. It is difficult. And when they go to A&E or go to urgent care centers, they are dismissed that they are wasting their time. They should go and see their GP. So there lies your conundrum. How do we address this in the community so that our people will engage? That's my contribution. Thank you.
Thank you so much.
Thank you.
Dr. Khan.
And Dr. Khan. Dr. Khan, I'm sure you will be part of the panel in the near future. So please get ready for a session with you. Thank you.
Thank you so much, Dr. Khan. And with Paul, if we can run the last poll, just to see where we are after listening to all these people, eminent people here, where we are, and then hopefully we can tailor this going forward as well. Dr. Khan, thank you, and I'm sure there will be more opportunity for us to work on anything that you have mentioned as a community. The only thing we want out of this to make sure that we come out better, not weaker. So we will run the poll for the last one to see where we are, and then that will lead us to the closing remarks and the vote of thanks. Right. I'm guessing that the poll is out and done. We will now call on, in doing so, I want to obviously acknowledge all those groups who have made this possible, the doctors, the experts, the professionals who have volunteered their time and been with us. You have given us so much that we can never buy anyway. And I hope it will help us all to make better informed decisions. We now want to move on to the closing remarks, and I call on the representative of Ghana Nurses Association to take us forward, please. If the chair of the Ghana Nurses or her able representative is here, please let us. Do we have anyone from GNA, the chair lady or the vice, or any representative to give us the closing remarks, please? Can we unmute Dr. Emma Madi? Dr. Emma Madi, who is from Education Unit of GNA. Dr. Emma Madi. No, can we unmute Martha Nugent? Martha Nugent, please. Right. Do we have Martha Nugent unmuted, please? Or Dr. Imamadi, one of them? Sorry, it's very difficult, obviously, trying to run through where the names are, and I'm sure you would appreciate that, but we don't want to take too much of the time waiting.
Me? Yes, I've unmuted myself now. Thank you. My name is Martha Nugent, and I'm the chairperson of the Ghana Nurses Association UK, who have worked in collaboration with Ghana Union and the Western Region Nurses Association to move this program forward. It has been an honor to be amongst such accomplished individuals, to be able to present my perspective before you. I acknowledge the orchestrators of this event, Catherine Owusu, Mr. Emmanuel Kweisin, for working hard to bring together the most dynamic panelists, Drs. Danso Zubaro, Dr. Ampia, Dr. Owulabi, and Ms. Belinda Danso Langley. The intention of this session was to predominantly reach out to our BAME and Ghanaian community to dispel the myths, misconceptions, and all the negative perceptions of the COVID vaccines. We have listened to our panelists. We have listened to the experts. We have heard what they have said. The information they have provided has been well assimilated and experiences shared. It is our prerogative to make informed choices and decisions focusing on our health, our lives, and our safety, and risk management out in our workplaces. At the end of the day, many of us have heard from interesting angles, and we have ably covered here tonight the ultimate to the point. And this has exacerbated the fundamental and niggling concerns, but discreetly shared amongst ourselves. Thank you for your time. Please, let's continue to reach out to our Ghanaian community, to our colleagues, to our family and friends. Let's talk about COVID and vaccines. Let's work together and reach out to all our family and friends. Thank you for listening. Have a good night. Stay safe and well. We will see you in 2 weeks' time. Thank you to our panelists and our audience.
Thank you very much, Chair. Thank you very much. I will share the poll with you. You'll be pleased to know that as it is now, from the time we started to now, we have 92% of people who listen to us on all platforms via Facebook, YouTube, and Zoom, agreeing that this awareness session has been useful and it has helped them to gain much more knowledge. All we have done today is to give you the information, and I'm sure it will help us to make decisions for ourselves. Coming up in 2 weeks' time, on the 26th of February, we will be looking to debunk, the screen will be shared, see the flyer, but our next forum will focus on COVID and the vaccines, debunking the fact from faith, tradition, and cultural perspective. As a community, we know far too well that a lot of our hesitancy and a lot of the myth around it is not only about what we hear, but it's also about our beliefs and what our pastors, what our ministers of religion, what our faith tells us. And we want to have that aligned with the scientific fact alongside the religious and cultural norms that we know of. We will still be adding a few panelists where possible in terms of the areas I've mentioned, and we will have everything going on over the next 2 weeks and beyond. Please join us as we do this for the good of the community and save lives. At this point, I will call on the representative from Western Region Nurses Association to give us the vote of thanks.
Irene, are you here?
We need to unmute Irene. I'm not sure what name she's got on.
Irene Palomeno.
I am here.
Thank
I'm
you.
here. Right. Thank you very much for the opportunity to end this very informative session. It's been lovely a pleasure to see so many of us here. It shows how passionate and keen we are to protect ourselves and others, thereby taking time to come and listen to this session on this issue that is affecting us worldwide. As Dr. Khan mentioned earlier on, it would be really, really good for us to be able to bring with us next time those who really need to hear this information. That is our friends, families, and relatives who are engaged in jobs where they are really, really, really at risk of the COVID disease. However, are reluctant to take this vaccination. On behalf of Ghana Western Regional Association of Nurses and the Ghana Union, I would like to take the opportunity to thank our panelist speakers for taking time out of their busy schedules to deliver such informative session on COVID-19 and the vaccine. We thank you all who logged in to listen and those who participated in one way or the other. We hope that this message from this session this evening will enable all of us to make informed decision in our choice whether or not to take the COVID vaccine to protect ourselves, our friends, our families, and our colleagues. We hope to see you at our next session on Friday, 26 February, to learn even more about this important session. Thank you all very much, and we hope to see you soon. Thank you.
Thank you so much. Thank you so much. Just to let you all know.
Quick question: are we debriefing after this? Do we stay on as a team?
No. Yes.
No.
We will deal with that in a private WhatsApp chat quickly.
Okay.
Please, these videos will be available on our Facebook and our YouTube channels. Just log in and go to @Ghanaian Community Awareness Forum, and you will see the videos of everything. Those who have missed it, send it to your friends, like it, let them know about it so that we can reach as many community as possible. Let us also know that without the help of Betty and Catherine from Multimedia, Multicultural Organization, who brought us together to help us get all these very good panelists that we've had today, probably it will be difficult, and I do thank them. World Remit, best way of sending money, are keen to support us, and we will encourage you to use their services so that they can support the community. Until the sunrise tomorrow morning, it is the Ghanaian Community Awareness Platform and Forum saying thank you and good night. Thank you.